Hi, I'm Dory Campbell, nurse practitioner and owner of All About You Wellness. Today we're going to talk about estrogen and what happens when it's too high or too low in your body. There are a lot of things that can happen in your menstrual cycle and reproductive health. You can have irregular or absent periods, reduced fertility or difficulty conceiving, vaginal dryness and discomfort during intercourse. With your bones, there's an increased risk for osteoporosis and bone fractures due to decreased bone mineral density. Within your cardiovascular system, there's a higher risk for issues, including heart disease, due to the protective effect of estrogen on the blood vessels. With your moods, you can have an increased risk for mood swings, depression, and anxiety. There's also a potential impact on cognitive functions such as memory and concentration. You can have thin skin and reduced elasticity of your skin, dry skin and hair, hair loss or thinning. All of these things happen when estrogen is not high enough to protect. You can also have urinary symptoms such as increased frequency and urgency and an increased risk for urinary tract infections. Overall, your general well-being can be affected by hot flashes and night sweats, fatigue, and changes in sleep patterns. When your estrogen is too high, within the menstrual and reproductive system, you can have irregular menstrual cycles or heavy bleeding, and an increased risk of developing ovarian cysts or fibroids. There is also potential for reproductive disorders such as endometriosis or polycystic ovarian syndrome. Your breasts can be tender, have swelling, or have an increased risk of developing benign breast conditions. You can have problems in the bone with an increased risk of bone loss or osteoporosis over time. You can have mood swings, anxiety, irritability, and possibly an impact on your mental well-being, potentially exacerbating conditions like depression. Within the cardiovascular system, we see an increased risk for blood clot formation, such as deep vein thrombosis or pulmonary embolism. There's also an impact on blood pressure and lipid levels. You can have acne and oily skin, possible hair thinning or excessive hair growth in the areas like the face, also called hirsutism. Your weight and metabolism can be all out of whack, so we see weight gain, particularly in the hips and thighs, changes in metabolism, potentially leading to increased fat accumulation, and we also see, back in the urinary system, an increased risk of urinary tract infections or incontinence. With your digestive system, we can see bloating or digestive discomfort. Thanks for watching. Like and subscribe for more information.